Hi, my name is Caitlin Whaley, and I did my project on fentanyl overdose in adolescents. So I came up with a scenario. A patient arrives to the ED via ambulance by a call from a bystander who discovered a 17-year-old male on the ground with a slow, thready pulse and unresponsive. Patient appeared pale, cool to touch, not breathing, and in ventricular fibrillation. Bystander called 911 and proceeded to start CPR. The bystander had naloxone with them and administered it to the victim via nasal spray and continued CPR. When EMS arrived on the scene, the bystander told EMS that she gave the boy naloxone because after having a friend that died from an overdose of fentanyl, as well as being aware of the U.S. fentanyl epidemic, she always carries some naloxone with her. Victim appears to be a GCS of 5 with flexion response from pain. After continuing CPR, administering a shock through the defibrillator, and delivering a dose of naloxone, the patient was successfully revived. The patient is now on mechanical ventilation due to not being able to breathe on his own. The patient has now been transported to ICU. The pathophysiology includes that fentanyl is a high-potency synthetic opioid. It works by binding to opioid receptors in the central nervous system, so it alters the response to and perception of pain. It causes pinpoint pupils, also known as meiosis, and respiratory depression. So the breathing can slow or stop, which can decrease the amount of oxygen that reaches the brain, also known as hypoxia. Fentanyl can also affect your growth and development, and it also contributes to the development of heart disease, high blood pressure, and sleep disorders. And as you can see in the picture, there is only a tiny bit of amount of fentanyl that can kill you. And fun fact, by the time adolescents are seniors, 50% of high school students will have taken an illegal drug, and more than 20 will have used a prescription drug for non-medical reasons. Some risk factors include peer pressure or friends and peers using illicit substances, wanting to perform better in school, white non-Hispanic race, depression and other mental health disturbances or ADHD, taking more than one substance at the same time, family history of addiction, stress relief, and the male gender. Although men are more likely to experience problems with drugs than women, progression of addiction is faster among women than among men. And some prevention includes having naloxone on hand, not taking more than prescribed, not consuming illicit substances, having fentanyl strips to be able to test the substance that you're using if it has fentanyl in it, practice medication safety, keep medication out of reach of children, and discard unused medication to police stations or local pharmacy.
So there isn't exactly an expected course for an overdose on opioids. However, not all overdoses are fatal. Opioid intoxication includes slurred speech, drowsiness, pupillary constriction, and psychomotor agitation. And then you might also need mechanical ventilation if the individual is not able to breathe on their own. Most of the time, you are expected to give Narcan or naloxone. So those are some expected actions that you would expect for somebody who overdosed on opioids. So some signs and symptoms of an fentanyl overdose consists of essential nervous depression. This is also known as opioid toxicity triad. and that consists of respiratory depression, pinpoint pupils, and decreased level of consciousness. Some other symptoms include confusion, shallow breathing, limp body, cold or clammy skin, not responding to painful stimuli, and blue lips and fingers. Some labs and diagnostic testing. So there's no specific test to determine if someone overdosed on fentanyl. However, you can do a drug screen to see if fentanyl is in their system. You can do a urine drug screen or serum drug levels. However, a urine drug screen is the most preferred method as it is non-invasive. You can also tell by giving the antidote such as naloxone and see if they get better. So for medications and other treatments, you've heard me mention naloxone or Narcan multiple times, and honestly that's the biggest savior for anyone who overdoses on fentanyl. So the antidote for fentanyl or opioid overdose is naloxone, specifically by it's an opioid antagonist, and you can give it IM, sub-Q, IV, or inhaled through the nose. The nose is the most common one during on the street. So it reverses respiratory depression, coma, and other signs of opioid toxicity. Some other treatments would be CPR if the person has no pulse or if they are in an arrhythmia. You call 911 if you're not already at the hospital, and then also maintaining a clear airway or having mechanical ventilation. Some nursing interventions include monitoring vital signs and pain levels, dispensing naloxone, performing CPR, assessing the level of consciousness and suicide risk, and risk for harm to self or others, remove any potential harmful items, and health promotion activities that address the prevention of drug use. So you might be thinking, who would be part of our team? So some collaborations would be with peer counselors, psychologists, psychiatrists, respiratory therapy specifically for mechanical ventilation, EMS if they were found out of the hospital, and then the emergency department providers and nurses, as they would be the ones to help treat the fentanyl overdose. So some complications of a fentanyl overdose, other than the most obvious one being death, is cardiac arrest, respiratory depression, orthostatic hypotension, sedation, and again with that opioid toxicity triad of coma, respiratory depression, and pinpoint pupils. You can also see hypothermia in the opioid overdose as well. Although there has been a decrease in overdose death rate, it's not related to the decline in use of illicit drugs, but to the increased availability of naloxone. So even though we are having a decrease in overdose death, it's still best for us to educate our patients on signs and symptoms of an overdose, as well as carry naloxone, and talk to somebody if you think you have an addiction to fentanyl. That would be the first step. And then call 988 for the Suicide and Crisis Lifeline. And then as a last resort, absolute last resort, if you choose to use fentanyl, do not use it alone. So make sure that you are around other people in case you happen to have an overdose. It is actually suggested that most overdoses are caught by someone that was going to use and decided not to because they saw the other person overdose. So, those are just some education that we can give to our patients. And this slide includes my references, and that concludes the slideshow. If you have any questions, please let me know. But thank you so much.